Let's discuss the functions of joints. And really, there's only two functions when you're talking about joints, and the most important one is movement. When you think about joints, you think about being able to move, and that's exactly what the main function is, specifically when we're talking about those synovial joints. So these are the most numerous types of joints, and they are organized in a manner to either allow them to have movement in many different axes, or sometimes only in one axis. And we'll talk about these differences between these 6 types of synovial joints in a later module. So movement is the main function. That's what we'll spend a lot of time on, but I also want to note that it plays a role in terms of facilitation of growth, specifically in these primary cartilaginous joints. And we've talked a lot about this, just not in this specific terminology. And that's referred to as a synchondrosis. And all that is those epiphyseal plates that we talked about when we were talking about endochondral growth of the bone. So remember, in these regions, so here's your epiphysis, here's your diaphysis, and then you're going to have that hyaline cartilage in the middle that will eventually be replaced with bone on that diaphyseal side. So, whereas most of those synovial joints are going to be freely movable, these synchondroses, there's no movement whatsoever. It's there in order to facilitate the bone growth.